Hello and welcome to The Point. Alarm grows over the spread of COVID-19, this time in Southeast Asia, where China's foreign minister met with his ASEAN counterparts to discuss a joint strategy. Just how prepared are China's neighbors and what's at stake? And no more military exercises, joint military exercises, should I say, with the U.S., says the Philippines. What's happening to these treaty allies? Welcome to The Point, coming to you live from Beijing. I'm Wang, sitting in for Liu Xin. Now, Chinese Foreign Minister Wang met with the ASEAN leaders in Laos on Thursday to discuss a joint strategy for fighting the coronavirus. 6 of the 10 countries in the association have reported cases, raising alarm over how serious the situation might get and how prepared the countries really are, given the country's proximity to China, but also strong business and tourism connections. How important is China-ASEAN cooperation at this time? What's at stake for all parties and what China can do to help? Joining me to discuss it all from Bangkok is Boonpracong, former advisor to the Thai government. In Beijing, Mr. Hailin, Vice Dean of the National Institute of International Strategy at the Chinese Academy of Social Sciences. And also in Beijing, Einar Tangen, current affairs commentator. Welcome, gentlemen. First, let me go to you, Einar. Well, first of all, let's take a look at some numbers of the 10 countries and regions outside Chinese mainland. That the reported cases, 4 are in ASEAN, and among the ASEAN countries, Singapore has the most, with 81 confirmed cases, followed by Thailand, that is 35 as of Thursday. The other 4 countries with infection cases are Malaysia, Vietnam, the Philippines, and Cambodia. 4 countries do not have any reported cases yet. They are Indonesia, Myanmar, Brunei, and Laos. So, Einar, is there any reason why some countries got hit harder than others and other countries, on the other hand, do not have any cases at all, for example? Does it come down to a matter of sheer number of people traveling to these places or measures that have been placed, or just pure luck?
Actually, it's pure luck and travel patterns. Wuhan is a very important trade area. And it was really, the virus basically followed the people who were infected from that epicenter of this viral outbreak. So there's nothing to be read into it. It wasn't at that point anything anybody knew about. They didn't realize how the virus worked, how it was transmuted. So at that point, it was going out and people just didn't know it. So nothing to be read into that.
So new cases seem to have been declining in mainland China. Do you expect that to be the case also for ASEAN? Einar.
Yes, I would expect so, but it all depends on where the cycle is. Remember, these are secondary and even tertiary infections, e.g. one person gave it to somebody and then somebody gave it to somebody else. It all depends on the ability of the governments to recognize it and quarantine it, to take appropriate measures before it spreads. They know that you need to wipe down surfaces, that wearing masks is very helpful, keeping people out of crowds, very useful, identifying those people who have been at risk because they've been exposed to infected people. That is the way to handle this, not generating widespread panic. And that's the real issue here. Right now, you have a number of countries, the U.S. leading the charge, which is trying to, basically pile on at this point, making a very difficult, tragic situation even more difficult by substituting political and economic agendas.
Definitely, we'll come back to the travel policies later. But Sean, let me go to you. In Thailand, you are in Bangkok right now. What is the situation on the ground? Does the general public think the measures carried out by the Thai government are strong enough, and do you?
I believe the current government has a more or less a flexible approach to this. They have made a soft warning for people not to go out, but also the way the Chinese government restrict the Chinese tourists into the country, which at 100,000 10% of what it has been prior to this coronavirus. That in itself has stabilized a great deal. As you can see, we opened the country for tourists, unlike the rest who are trying to close it down. Thailand, the government believes that they have a good handling on this situation due to the fact that when China started this research, Thailand has announced it 2 days before that they have discovered this virus. So therefore, strong protective and preventive, strong case capability, strong, more or less, communication for the risk. It has somewhat paid off, but Thailand, I do not believe, should relax. There are unknown in 4 countries, especially bordering China, especially in Laos, in Burma. We are uncertain of how our technical capabilities should there are more the outbreak spread over there. So we are cautious.
Right.
And most of the Thai cases that were infected from, not infected, sorry, the tourists from, student from Wuhan, they were detained for 14 days. They all went home. The statistic stable at 35 and hasn't increased. So let's keep our eye crossed that it could be contained.
So Einar, you were talking about U.S. travel policies. Many Chinese students ask me this question because many of them came back before the Lunar New Year, and they are currently stranded in China, literally. They cannot go back to the U.S., and there are a lot of prospective students applying to U.S. universities, prospective travelers from China who want to go to the U.S. So when do you think these travel restrictions will be lifted by the White House?
Well, at this point, it looks more like it's politics rather than health concerns. I mean, it would have been very easy to allow these students back in and just ask them to quarantine themselves for a 2-week period in their dorm rooms, etc., and make sure that they are all right, and then allow them to continue schools. This is causing havoc among universities who have a large number of Chinese students enrolled there and depend on the money that those tuition brings in. So at this point, it's very clear. The U.S. government has decided that this is another pressure point, along with Taiwan and Hong Kong, Xinjiang, Tibet, you name it, where they can, in essence, try to put more pressure on China. It's not clear what they think they're going to get out of it, given that the phase 1 is there. But it is very clear that Donald Trump has it in his mind that he wants to have China sign a phase 2 that are on his terms, and if he had his way, he'd like to do it before the election. So this is more about election politics than it is about health or any kind of human response to what is otherwise a very large tragedy.
We certainly see a lot of events unfolding from both capitals, Beijing and Washington. Einar, I understand you'll have to go. Thanks so much for joining us tonight. I want to go to you, Mr. Ye. The Philippines, Singapore, and Vietnam have carried out restrictions, ranging from suspended visas to more aggressive screening in the airport. What's your take on those preventative measures?
I think China and the Chinese people fully understand the restrictive measures taken by Philippines, Singapore, and Thailand, and another ASEAN members, because these restrictive measures were taken at the moment of the breakout, not take it into the place at the recent days. So and when the COVID-19 breakout, a lot of countries has no idea how to address this threat. So taking self-protection measures is natural. And also we also need to notice that the ASEAN country not only take the measures to protect themselves, but also provide fully support for China and Chinese people to address the threat of the COVID-19. And they help us to escort the Chinese people who stay in this country come back to China a lot, and also provide some materials and equipment to China. So we are not only see the one side of the coin, this the restrictive measures. We also need to see the contribution made by ASEAN members. So that's the reason why the State Councilor Wang also addressed that in this the conference, that they need a joint effort and the full cooperation to address this threat by the China and ASEAN countries. So for China, I don't think we are only focusing on the when and how the restrictive measures taken by ASEAN member will be released. We also need to see and make a detailed research that what we can do together to eliminate, to address this threat.
So, Sean, you said we must pay attention to the unknown unknowns. So we understand that Thailand has no travel restrictions towards Chinese tourists. Do you think the public in Thailand should be concerned?
A huge segment of the internet world are quite concerned and have rightly so. However, for the past 12 years, when the last time Thailand faced SARS, I think the Thai doctors and scientists has used the same formula with a certain amount of doses adjusted to keep those patients treated. And you have to remember, out of 160 total Southeast Asian cases, over 60 have recovered, and there has been no death in this region. And being a warm weather may have something to do with it. However, that situation is a wait and see. That the Thais believe that they can do it, especially the government. We have some of the best doctors in the region. Thailand has the best 6th ranked WHO rating to handle this special type of outbreak. But I, as an outsider, have to be slightly skeptical, just for the sake of discipline, so to speak, so that we don't want to get over-relaxed, especially when we have no case at all from Burma and Laos, as our neighbor, and too low of a statistic. And Cambodia, in the case of many patients, when they left the Western
certainly, it's no time for relaxation, as you mentioned, Sean, because we just had news of new cases confirmed in Beijing. That is, in fact, just about 10 kilometers from where our studio is. So no time for relaxation. Mr. Ye, I want to go to you. For the countries that have not reported any cases at all, what are their priorities to prevent the epidemic?
Of course, we fully understand that such kind of country has to concern this dilemma that maintain the public to ensure the public safety and also maintain the normal economic growth. But I think public safety, public health should be the priority, and some measures should be adopted before we found 1 or 2 or confirmed patients. So for example, some the tracking measures on you can send some early warning to try to guide the people to wear the face mask and so on. And I think such kind of measures will bring some positive consequence to address this threat. Not only when we find this case confirmed and then we take the measures, that means that there will be a lot of unknown threat. It's already on the street. So take the measures as early as possible. Even sometimes, in some cases, will bring some negative impact to the economy and social orders. It will be worth it. See the case in Wuhan. 2 weeks delayed, what happened? So I think this is a lesson, very useful lesson for all the countries, not find any other individual case yet.
Definitely, definitely. Better safe than sorry. We got your point. Thanks so much, Sean Boonpracong, former advisor to the Thai government, and Hailin, Vice Dean of the Chinese Institute of International Strategy at the Chinese Academy of Social Sciences. I understand that Mr. Ye will come back to join us later on, and we'll take a short break. Stay with us.